What I'll have you do is just sign your name there and then date there, and this just says that you agree to be tested by our agency, okay?
On the 25th of March, I went to get myself tested for HIV at the AIDS Resource Center office on High Street, thinking there would be needles and blood involved. Most people think that a blood test is required if someone wants to be tested for HIV. But in fact, free HIV testing available around Columbus can be as simple as a mouth swab or a prick of the finger, and it never takes more than 20 minutes.
A lot of times people come in and think they're engaging in risky behavior, and it's really not all that risky, or vice versa. Sometimes people are doing things that put them at great risk and they don't even know. Someone will come in and they want to be tested for HIV. So a counselor will go get them from the waiting room, just introduce themselves, bring them to a room where they feel comfortable in so far as that their information is being protected. Because we want to make sure that they can talk to us about anything that they may be concerned with in terms of what they think they're at risk for. Then you try to help them develop an individual risk reduction plan that would work for their life.
So here's how we would do this. This is the consent form for receiving an HIV test. And what I would do is just allow you to read along as I give you this information. And if we're going through this process and you start to get really anxious, you feel like you don't want to do this anymore, let me know. It's your right. I'll stop the test, okay?
To take the test, Brittany brought me to a separate room called the testing lab.
What we're testing for is the presence of HIV antibodies in your saliva.
I need you to put this flat between your gum and your cheek, and then run it across the top of your gum line, and then run it across the bottom of your gum line. Place it up top on your gum and your cheek, right, like that. Put it as far up as you can, and then run it across the top of your gum. Keep going, and then run it across the bottom of your gum.
And you drop it in some developing solution, and it takes 20 minutes to develop. It's kind of like a pregnancy test, so if it's positive, there'll be 2 lines. If it's negative, there's 1 line.
Once we're done with the mouth swab, I was brought back to the room where we started, and I filled out a survey on my sexual history. I was free to ask any questions or voice out any concerns I had regarding my sexual health.
We like to give people an opportunity to really ask questions so that they can really get the knowledge that they need to protect themselves. In general, I think society has this idea that people who are infected with HIV are promiscuous or they're living unhealthy lifestyles. But we have people that, are in long-term relationships and their spouses cheat on them. People's perceived risk is different. 1 in 6 people who have HIV don't know they have it. So it's not always a matter of honesty or knowing somebody, it's really a matter of getting in here and getting a test.